Hello, my name is Erica Diaz, and this is my week 3 assignment, the case analysis. So the overview for this assignment is the scenario is Melissa is a freshman in high school. She began the year as a happy-go-lucky type of student. According to her teachers, however, roughly midway through the year, she had a drastic change in personality. She appears to be withdrawn, her grades are slipping, she's starting to ditch school. One day, her older brother, who also goes to the same school and you have a good relationship with, comes to you and says that he's worried about his sister. He tells you that she has made comments about hurting herself. He also says that he's worried. So you immediately reach out to Melissa, who in fact does confirm that she has had thoughts of hurting herself. After meeting with Melissa, you call her mother, who states that she's just being dramatic. This is typical teenage behavior, and she's at work and doesn't have time for this. So she really just blows off the situation, doesn't show any concern, and really downplays Melissa's warning signs of wanting to hurt herself. So in this scenario, a school's counselor is going to come across various ethical principles. So ethics are agreed upon values governing the conduct of a professional member of an association and reflect the changing nature of the profession. So for school counselors, the school counselor association has a set of ethics standards that really act as guidelines for how school counselors should behave and how they should conduct themselves professionally. So some of the school principles are autonomy, which is freedom of choice and control of one's life. In particular, this scenario, this principle is really important. It is non-maleficence, which is do not harm the clients, do no harm to the clients. And lastly, justice, which is fairness and equability. It's important for school counselors to really know these ethical standards because as you go throughout your career in various scenarios and situations, these really will help school counselors and act as guidelines on how to perform their job and really shows the best course of actions that aligns with the standards as well. So some competing issues are as a school counselor and as a concerned adult, when a student is stating they have intentions to hurt themselves, our first instinct is to help that student. So when a parent disregards warning signs or shows a lack of concern for a child's well-being, this can create a moral dilemma for the school counselor. One side of us really wants to help the student. One side of us understands that parents, they have their rights, but when a parent fails to really be supportive or really help a student or show concern for their child, that really creates a dilemma for a school counselor. Parents are legally responsible for their children until the age of 18. That being said, in some cases, parents can refuse services for their children despite the fact that the child may be in great need. Ethically, school counselors have an obligation to help students succeed and promote mental health. And in this scenario, the school counselor definitely has an ethical obligation to Melissa, who is stating she wants to hurt herself. So personal issues for this scenario is that moral dilemma, the dilemma of wanting to help the student versus the wishes of the parent. The parent saying this isn't a big deal, she's just being over dramatic. But as a concerned adult, the student is saying, I want to hurt myself, I've had these thoughts, these ideations. We definitely want to act upon that and not take those lightly. Also, something that can impact the counselor's ability to respond and how they respond and the course of action they take is that the counselor themselves may have had personal past experience dealing with suicide, and this definitely can impact their judgment and really even make them over willing to help a student. So that's something to keep in mind. Personal experience does impact our judgment and how we act. The last personal issue is the lack of concern by Melissa's mother can anger a school counselor or any concerned adult. Showing a lack of regard for the student in this particular situation really can cause upset feelings, anger, and that can also in turn lead to the counselor maybe being unprofessional to the mother. So that's something to definitely keep in mind, that bias, and we need to be able to keep that in check and act professionally at all times. Some of the ethical codes set forth by the American School Counselor Association is A.6, appropriate referrals and advocacy. Most importantly for this scenario, A.9, serious and foreseeable harm to self and others. We need to inform parents and guardians and or appropriate authorities when a student poses a serious and foreseeable risk to harm themselves or to others. So some considerations to keep in mind when trying to find the right and appropriate course of action is ethical standards, which the American School Counselor Association has a set of standards that really can help school counselors guide their decision-making process. Also professionalism, like I said, personal biases, personal beliefs, past experiences could all factor into how we conduct ourselves, and it's important to keep those in mind because we always need to be professional. Confidentiality, especially in this scenario, confidentiality is something important. If we are reaching out and collaborating with other school personnel, we need to make sure that they have the legal right to know these things that we're telling about the students. So school counselors do need to be mindful of confidentiality and who are they telling details about the students' lives to. Appropriate referrals, advocacy, responsibility to self, responsibility to student, and lastly, responsibility to parent and guardian are all considerations that need to be taken into account when making a decision. So for this scenario, there's a couple of courses of action. Option one is do a risk assessment, send the student back to class, follow up with the student and see how they're doing maybe in a day or two or the following week. The consequences for this option is that if the student in fact does end up hurting herself, school counselors can be held partly responsible and also be charged with negligence. Option two, collaborate with the school psychologist and proceed to do a risk assessment. Also make additional contact and recommendations to the student's mothers for her to follow up. A consequence for this would be as same as option one, that if the student does hurt themselves, school psychologist may be held partly responsible for that. Also, given the mother's lack of concern, the fact that she would actually take the daughter to follow up with some sort of mental health professional outside of the school is highly unlikely. Lastly, the third option is to do a risk assessment, collaborate with other school counselors, maybe for feedback and advice. Definitely collaborate with school psychologists on campus or any other school health professionals on campus. If necessary, given the risk assessment, if the student is at higher risk, it may be needed to call the local sheriff's department to do a further assessment and possibly place the student under a psychiatric evaluation. And also, given the situation, it may also be needed to call Child Protective Services. The mother showing a lack of regard for the child may indicate that there are more serious issues going on at home. So CPS can offer further support and resources. So I think the best course of action in this scenario is option three, which is collaborating with school psychologists, doing a risk assessment. If the student is a high risk, then contacting local sheriff's department and getting the student placed under observation for her own safety. And also contacting CPS because additional steps need to be taken or may need to be taken. And bottom line is the school counselor, their primary responsibility is to ensure the safety and well-being of the student. And by following option three, we're not only assuring that the student will be safe, we also are acting within the guidelines of the American School Counselor Association Code of Ethics, and all the while keeping in mind school district policies. Consequences of this can be calling the sheriffs, calling CPS can definitely create tension between the parent and the school, and also can alter the trusting relationship that the student may have with that counselor. That being said, sometimes it is best to make those hard choices, even if it is going to affect the relationship you have with the student. And that is my assignment. Last slide are the references used for this assignment, American School Counselor Association, and our textbook for the course. Thank you.